it's Breast Cancer Awareness Month, we want to touch on genetic testing for breast cancer and what folks need to know. So Dr. Sarah Kahn is a certified genetic counselor with UF Health, and she joins me now with the details. So thank you for joining us today.
Thanks so much for having me.
Of course. Okay, so first, let's just get into what genetic counseling is.
Sure. So genetic counseling is really just the process of meeting with somebody like myself. And during that visit, we go over things like your personal medical history, your family history to better understand your cancer risk. And are you potentially somebody that could be at risk for a hereditary cancer condition? That's one of the things that we go over. And then with that, we also discuss your genetic testing options. So what's available to you? What kind of information are you interested in getting back as a patient? And is it answering the questions that you potentially have about your health?
Yes, it's all so fascinating, the fact that that's even an option. So how does it really help, though? Just because you can really get down into the details, I guess?
Yeah. So when we get back genetic testing results for a patient, and I even just think going over your family history and your medical history can be really helpful to put everything into context. Sometimes I think patients walk in and they're really concerned about something. And as we start going through it, it may not be as big of a concern as they initially thought. And then once we do get back genetic testing results, it really helps us figure out what kind of screening tests may be important for you, what age those things should be starting at, and then also being able to share that with your family members. So your children, your siblings, your parents, that kind of a
Oh,
thing.
yeah. So then you'll be passing that information along down your lineage. That's pretty neat as well. So how do we know who needs genetic testing and at what time?
Good question. So, with Breast Cancer Awareness Month, I think it's a great time to just make a plug to ask some of those questions. Sometimes we just don't know until we ask. So, asking your family members, asking your parents, hey, has anybody in the family had cancer? What kinds of cancer have people had? And then sharing that information with your healthcare provider. So, anybody that has a family history potentially of breast cancer, ovarian cancer, prostate, and pancreatic are also part of that spectrum. I know.
Wow.
That's all fair game that can be related back to breast cancer. So if you are somebody that has a family history of any of those things, I would definitely encourage you to speak with your provider about that. And then they can help make further determinations about, do you need a referral or what kind of testing should potentially be ordered?
Okay. And I'm sure a lot of people think, well, yeah, who wouldn't want to get this done? So is insurance covering this?
Great question, the $1 million question that everyone asks me. So the good news that I think a lot of people are surprised about is that yes, most insurance companies, both government and private, do tend to cover genetic testing. What it really comes down to is medical necessity, like anything else in
I
healthcare.
see.
So as we think about genetic testing, part of meeting with your provider is them being able to tell you, hey, is this going to be covered? And what does that look like? And really, as long as we're able to prove medical necessity, what we've seen for most people at our clinic is that genetic testing is usually less than $100, which is a pretty good gig.
Wow.
And if it's not covered, or if there are circumstances where insurance won't pay for it, we definitely do try our best to make sure that cost is not a barrier if you are somebody who's interested in seeking care.
And if they get it done, will that potentially affect health insurance coverage?
Great question. So, about 10 to 15 years ago, the US passed a law. So, federally, there is a law in place called GINA. It stands for the Genetic Information Non Discrimination Act, GINA. And that protects against any discrimination for any kind of genetic testing results based off of your healthcare insurance and then your employment. And then Florida, probably 2 or 3 years ago, is one of the only states that passed an additional provision to also protect against life insurance, long-term care, and disability discrimination. So if you do get genetic testing in Florida, you are very robustly protected.
Oh, well, that's good to know. So if somebody wants more information on this, where can they go?
Yep, so they can definitely go to our UF Health website if they are interested in getting an appointment or learning more about any of our providers or our clinics, whether that's for breast health or for genetics. And then if you are interested in getting any other information about genetic testing, the National Society of Genetic Counselors website is nsgc.org. They can also visit that for more information.
And of course, talk to their own doctor to see if maybe they would need a referral, right?
Absolutely.
All right, wonderful. Well, thank you so much for joining us today and empowering us with knowledge.
Thanks so much for having me.
Of course. And if you'd like to see this interview again, just head to our website at firstcoastliving.net.